I'm Dr. Mark Prasarn, Chief of Spine Surgery with the Department of Orthopedics here at the University of Texas. I'd like to address with you today one of the most common injuries that most people will suffer from at some point in their lives: low back pain. Low back pain is the second most common reason people see a medical doctor, number one being upper respiratory infection. Over 90% of individuals will experience an episode of low back pain during their lifetime. The vast majority of individuals with back injuries will not require surgery, even if the low back pain persists. In most cases, low back pain will resolve or can be managed with conservative or non-operative care. The key component to this conservative care, as well as helping prevent future occurrences, is physical rehabilitation. This rehabilitation strategy should consist of a program of core strengthening alongside aerobic conditioning. Today, we are here to show you a core strengthening program that you can do at home. This program can help you recover from a current back injury, rehab after surgery, or help prevent future episodes of low back pain. Let's meet our team and get to work. Roland Ramirez is a licensed physical therapist and a certified athletic trainer with the Houston Texans. He is also their rehabilitation coordinator. Kim Sermon is our physician's assistant in the Department of Orthopedics here at the University of Texas.
So Roland's going to be our instructor, and he's going to show us how to do the exercises, and Kim and I will help demonstrate. The vast majority of back problems will hurt in some extreme of motion, so either forward flexion or extension back. So we'd like to emphasize a core strengthening program, again, strengthening the abdominal muscles in the front, the paraspinal muscles in the back, and the obliques in between, that emphasizes a neutral base spine posture to help avoid aggravating your injury or pain.
So the first exercise that we're going to demonstrate is just a simple isometric hold, or an abdominal contraction. And so before we get started with that though, there is a normal curvature to the lumbar spine or the low back. It's important to maintain that curvature of the spine during all of these exercises. So first thing is we're going to have you place your hands in the small of your back just to maintain that spine. Now, first thing I'm going to ask you to do is just a simple, subtle abdominal contraction, okay? So go ahead and contract, okay? It's important not to perform an abdominal crunch, but just maintain this, okay? And it's also very important to breathe. You need to maintain your breathing through your belly and not through your chest. You okay? So what we're going to do is go ahead and contract, continue and maintain your breathing pattern, holding for 5 seconds and then relax. Okay? Go ahead and go again. Good. Contract. 2, 3, 4, 5, and then relax. Okay? We're going to do 3 more reps of that. Okay? Go ahead and contract. Good. 4, 5, relax. Good. Go ahead and contract. Yep. Maintaining your breathing. 3, 4, 5, relax. And then we're going to do 1 more. Okay? Easy. Not performing a crunch. Maintaining your breathing through your belly, and then relax. Great. And so we'll start off with performing 5 reps of that, 5-second holds. The next thing we'll do is we'll jump into what we call ball squeezes. And so again, maintaining this curvature of the spine, okay? Keeping your hands in the small of your back, okay? And now we're gonna perform this abdominal crunch, but with the addition of a ball squeeze. Okay, so just right here between your knees. Okay, just like that. Okay, so from here, again, we're gonna perform a 5-second hold. So we're gonna start with an abdominal crunch. Yep, and now just a really gentle ball squeeze. Okay, 3, 4, 5, and then relax. Okay, maintaining your breathing, of course, right? So go again, easy contraction, ball squeeze here, maintaining your breathing, and relax. Good. Okay, rep 3, ready to go. Just easy, not performing a crunch, ball squeeze, and then relax. 2 more, okay? Again, yep. Breathing through your belly, ball squeeze, and then relax. Last one, ready? Easy contraction, Good, and relax. So again, starting off with 5 reps, and then we'll go to an exercise that we will move your hands from the small of your back over to your side. And what we'll do is, again, an abdominal contraction, maintaining your breathing, and now we're gonna push into the floor, okay? And so we'll go ahead and start with this. We're gonna have a 5-second count, okay? So go ahead and abdominal contraction, maintaining your breathing. Now pushing both hands into the floor for 5 seconds, and then relax. Good. And going again. Easy contraction, okay? Press in here, and then relax. Good. Go again. Yep. Press in here, and then relax. Good. Go again. And relax. Was that number 4? Okay. And then one more time. Yep. And then push it into the floor, and then relax, okay? And again, it's important just to maintain the curvature of the spine, maintaining that neutral spine during these exercises. Very simple exercises. You want to make sure that you are pain-free with these exercises, and it's important to maintain your breathing pattern through your belly and not through your chest. To continue with our basic strengthening program, we are going to teach you how to perform a double leg bridge now. And so that will involve the same abdominal contraction we taught you earlier, plus the normal breathing pattern through your belly and not through your chest. Arms at your side, and then your feet just slightly apart. Okay, and so we'll start with an easy abdominal contraction, so we'll go ahead and start there. And then what we're going to do is we're going to raise our hips up off the floor and contract our glutes in this position. Okay, we'll hold again for 5 seconds, okay, and then relax. All right, and then we'll go ahead and repeat that. Simple abdominal contraction, okay, go ahead and raise your hips. Nice flat tabletop look to this exercise, and then relax. Good. Again, we are going to repeat this exercise for a total of 5 repetitions, just like we showed you for the previous exercises. The next exercise will be performed in the same basic position that we showed earlier, and it's going to be an isometric hand and knee contraction. And so it will start off the same with an easy and subtle abdominal contraction, belly breathing, and then we're going to have her with her right hand touch her left knee, and then we'll switch and perform that on the other side. Okay, so easy contraction here, maintaining the neutral spine, belly breathing, and then go ahead and lift this knee, pressing into that knee with your right hand. Easy 5-second hold, and then relax, and then performing on the other side. Easy 5-second contraction, maintaining that abdominal contraction, then relax. Okay, go ahead and repeat on this side. Okay. And then again, it's important to maintain your breathing, and it's just an easy contraction, and then relax. And you would repeat this for a total of 5 reps on each side for 5-second count each, and then we'll progress to the next exercise. The next exercise we're going to demonstrate is the plank position, or forward plank position. And so, Kim, what I'm going to have you do is go ahead and simply just walk out onto your elbows. And it's important that we'll have feet together and on toes. And again, there's a normal curvature to the spine, and so this is obviously okay, trying to maintain this contraction. It's also important that she is not extending her neck and looking straight ahead. It's better to have a neutral cervical spine as well, looking down at her hands. She would hold for 10 seconds, and then relax. You can go ahead and relax. Good. And then we'll do this again. So an easy abdominal contraction, okay? Maintaining this neutral spine, holding for 5 or 10 seconds, whatever you can tolerate, and then relax. Now, if this on your toes is too challenging for you or maybe causes pain, you can simply perform the exercise in this position, okay, on your knees. And so maintaining this position, okay, just like this, like Kim is doing. And then you can relax and go ahead and lie down if you need a break in between that, okay? Again, if this is not too uncomfortable for you. And then you can go ahead and come up on your knees again, maintaining this core contraction, neutral cervical spine. This is a forward plank position, performing for 5 or 10 seconds for a total of 5 repetitions, and then relaxing. So this concludes our basic core strengthening program. However, if you felt like these exercises were a little too easy for you, or if you need them to be a little more challenging, you can increase the number of sets or repetitions, as well as the amount of time that you're holding each one of these contractions. If you feel like you have graduated from this basic core strengthening program, we can show you some advanced core strengthening exercises that we can do next. So next we are going to demonstrate a few exercises in the advanced stage. And so I'm going to have Dr. Prasarn help me out with these. Please don't perform these exercises unless you are pain-free and you feel that these are appropriate and need to be challenged a little more. And so Dr. Prasarn, the first thing I'm going to have you do is go ahead and lie down on your stomach, just nice and flat. Okay, and so this is an alternating arm and leg exercise. And so it starts off with an easy abdominal contraction, and then I'll have him raise one arm and one leg just about 4 to 6 inches off of the floor, and then we'll repeat on the other side. And so the first thing, again, so easy abdominal contraction, Dr. Prasarn, yes. Maintaining this normal curvature of the spine. Make sure you're continuing to breathe properly. And then we'll have you lift your right arm and left leg at the same time. Good, nice easy contraction. Holding for 5 seconds and then relax. Good, same thing. Easy abdominal contraction. Now we'll lift your left arm and right leg. Holding for 5 seconds and then relax. Now let's go ahead and repeat that one more time. Okay, easy abdominal contraction, normal curvature of the spine, lifting here and here. And then relax. Good. And then repeating on the other side. Easy contraction, here and here. 5-second hold. And then relax. You would perform these exercises 5 repetitions on each side before we go on to the next exercise. So the next advanced exercise is going to be quadruped, alternating arm and leg extension. Okay, so Dr. Prasarn, I'm going to have you get in this quadruped position. So it's important for the initial position for your knees to be right under your hips and your hands to be right under your shoulders, okay? Maintaining a nice, easy curvature of the spine, okay? And like all exercises, we're going to start with a simple abdominal contraction, continuing to breathe, okay? And then raise your right arm and your left leg and reach for the opposite walls, okay? Maintaining this, holding for 5 seconds, nice and stable, and then relax. Now let's perform the same exercise on the other side. So easy abdominal contraction, normal breathing pattern. Raise this arm and the right leg together, reaching nice, good extended position. Maintaining your pelvis and your core contraction, and then relax. Let's go ahead and do that again on the right. So right arm, left leg, nice abdominal contraction, okay? Making sure you keep a neutral and stable spine, and then relax. Now performing on the other side. Left arm, right leg, good. Don't allow your pelvis to drop, okay? Nice, good core and stable contraction, and then relax. And so just like the other exercises, you want to perform 5 repetitions on each side, and then we will move on to the next exercise. So the next exercise we are going to demonstrate is, in the advanced stage, is the double leg bridge march and the double leg bridge knee extension. So first we'll start with the double leg bridge march, and just like the other exercises, easy abdominal contraction, normal curvature of the spine, hands at your side, okay? And then we are going to perform a bridge here in this position. So bridge up. Now what I'm going to have you do from this position, okay, is lift one knee straight up in the air, good. And then the other side, good. and then relax. Go ahead and relax. Good. Important to maintain your breathing, right? So we'll repeat that. Nice, easy abdominal contraction, normal curvature of the spine, lift up, okay? Now again, lift straight up. Good. Repeat on the other side. Good. And this is your double leg bridge march. Go ahead and relax. We'll perform this for 5 repetitions, okay, or 5 sets of that. And then we can move on to the double leg bridge with knee extension. So same basic setup, okay, easy abdominal contraction, okay, normal spine, lift up for me. Yep, now we're going to kick out. So kick your foot out, good. And then relax and then bring this one here, good. Kick it out, good. And then relax and then drop down, okay, good. He was able to maintain a nice, good, stable pelvis, which is what you want. So go ahead, easy abdominal contraction, normal breathing pattern. Go ahead and lift up, good. As you kick out, making sure there's no drop in the pelvis, good, stable spine. Bring this down, lift the other side. Nice, good stability there, and then relax, good. Again, performing 5 sets of this, and then moving on to the next exercise. But this is the double leg bridge with a knee march or a leg march, and then a double leg bridge with the knee extension. So the next advanced exercise we're going to show you is goes by a term of modified dead bug. Yes, it is a funny name, but it's actually a great core strengthening exercise and also for endurance. And so what I'm going to have you do first is it's going to be an easy contraction, same setup as before, and then we are going to touch opposite knee to hand and repeat that pattern with both of our feet up off the floor. So we'll go ahead and start. So abdominal contraction, good breathing pattern. Now lift your left leg, okay, and your right knee will touch. Good. And then we'll switch. Good. You notice that the feet are up. One leg's extended, one leg is flexed. We'll switch. And we'll repeat this pattern. Okay. Nice. Keep going. Good. Maintaining a good core contraction, maintaining that neutral spine and a good stable pelvis. Also, breathing is very important with this exercise. One more time. Good. Relax for me, Dr. Prasarn. Okay. So this exercise you can start off by 5 repetitions, performing 5 repetitions on each side. Can advance that with time, a total time of 10 seconds, 15, 20 seconds, whatever you feel is good and challenging, but also safe. And then we could advance to other exercises as well. So the last exercise we are going to demonstrate in this advanced core strengthening program is the side plank, both the left and the right side plank. And so again, starts with an easy abdominal contraction. You notice that Dr. Prasarn has his elbow down on the floor, feet are together over here on this side. And so what we're going to do is we're going to go ahead and raise up and to a simple side plank position. Good neutral spine, good stable spine and pelvis, okay? Holding for 5 seconds, 10 seconds, whatever you feel is safe and appropriate. You can go ahead and drop down. If you feel like this is a little too easy, you can also add a weight here. And so we're gonna have Dr. Prasarn, he has a kettlebell. You can use a kettlebell or a dumbbell. And so raise up, good stable spine, good neutral spine, holding again for a 5 or 10 second count. And then drop down, good. And then we'll go ahead and switch sides. So let's go ahead and demonstrate your right side. Same position, right elbow on the floor, feet together back here. Yep. And then go ahead and raise up. Good, easy abdominal contraction. Important to maintain your breathing pattern through your belly. Good, stable, neutral spine. Perfect, and then relax. And then again, you can add weight if you need to, dumbbell or kettlebell. And then raise up. Good. Make sure you're continuing to breathe. Good, and then relax. Good, doing okay? All right. So this concludes our advanced core strengthening program. Again, you want to make sure that you perform these exercises in a safe manner and those exercises that you feel are appropriate. If you feel like these exercises are a little too easy for you, again, you could advance them by adding sets or the number of repetitions or the amount of time for each one of these exercises. But we hope you've enjoyed the program, and thank you very much.
So hopefully those of you who watched have found this video informative, and this will help you formulate an approach to help treating your back pain. Again, the vast majority of people with back pain will recover on their own, and a core strengthening program can help expedite recovery and help prevent future occurrences of back pain, or potentially help you recover from surgery if you've had surgery. If you feel you're not recovering from your injury and not getting the results you want, or you want a more aggressive approach, or possibly you are a surgical candidate, we're happy to see you anytime. Please call our office or visit our website, and thanks for watching.